NCPI and other sources. Any specific drug information. If they want to prescribe a specific drug, they can look at a drug, learn more about it. We've integrated big maps where you can choose any particular hospital, see the list of physicians who are in that hospital. You can call them from here, right from this application. Maybe I can choose a different hospital in LA area. You can see a list of physicians. There is a conference to set up a live meeting. If the physician is not physically present, you can have him be available at a remote location. He can log into the live conference.
But I need OCS deployment.
This is OCS, this is live meeting. You need OCS for enabling, and OCS is integrated with big maps here. And here we have the patient information, the different patients. You can see the last 4 visits, why they visited the doctor, the data visits. And then here we pull in the patient record from different sources. The basic information is there. You can have
Passion banner.
patient images, you can annotate, make some marks, etc. You can see the actual medication, the image of the tablet, etc. So it's these are different widgets that pull data from different web services, irrespective of the vendor technology or the platform. If they can expose the data, they can consume.
It uses GNOME standard. Standard for medication, the codes, the coding medication is GNOME.
Yes, and this particular demo, we worked with GE Healthcare, and they are exposing it from their Centricity EMR product. So we don't have control over what data we get, we just get the data, including the images of the medication. But you can also pull it from the National Library of Medicine, where they have the standards defined, and most of the EMRs use those standards, so it should still be relatively accurate.
Yeah, the way that it can interact with electronic health record and personal health record, this application can interact with both records. This is personal health record.
And electronic medical record. So the Amalga, that was talking to electronic medical records and other PACS systems, where the physician was pulling information and then sending it to the patient. So it's an interaction between Amalga, indirectly it's the electronic health record.
Okay.
And this is also coming from the hospital side of systems, and you also have a personal health record.
But ILI Systems is a provider of technology for healthcare, or what? Any system.
Any system. Okay. As long as they are willing to share the data in industry standard format, we should be good with respect to integration.
And do you have any deployment in telemedicine or telehealth systems?
We are
like
working
remote system, maybe the person being in rural area.
Yes.
They can get conference too? The person, the patient can get conference?
Yes. But you cannot really call this a telehealth application. We are working on one in Colorado where the patient will actually pick up the phone, dial a 1-800 number, and then they just follow the instructions. That's on OCS.
Are you using Windows Azure, or you are hosting this application?
This one will be hosted on Azure. Not yet. The team is working on that. And this is something that we're doing for Microsoft, where they can give this to the salespeople to take to the field.
Okay. And how can I interact with Windows phones with this application?
Yes, good question. So the one that you saw here, once the data is sent to the patient, they can access it on healthwall.com or even on the mobile device. So they can use a mobile device and access the information from Healthwall. The physicians can also access the patient's information on their mobile device. I don't have the device here, but that's an extension that we developed.
Okay.
So it's multiple screens and the cloud is what you see.
So, anything else?
So tell me more about your program.
Hey, tell me more about our program.
Microsoft